Okay. All right. Morning, everybody. Ready to start grand rounds? Dr. Vanchiere has become very interested in this topic in his role, not only as a pediatrician, but as the current vice president of the state chapter of the American Academy of Pediatrics. So I think this is a good topic for us. This is really important. This affects a number of the patients that we take care of, and it's now become pretty clear that poverty plays a significant role in the outcome of the lives of many of the children that we serve. So I'm going to turn this over to John.
Thank you, sir.
There.
All right, so, infectious diseases cause epidemics, but poverty is still an epidemic, and that's really the take-home message for today. I will tell you I have no disclosures because nobody funds anything or anybody to talk about poverty or poverty research. We as a society do the funding through our census and many other things that happen. And our objectives today are to sort of identify some of the causes of chronic and acute poverty, identify families facing poverty because we're on the front lines as pediatricians, and really understand how to work with families to mitigate the stress of poverty on children and adults. And there's a growing literature in this area of poverty, and in the Academy of Pediatrics, one of the major areas that is a focus related to this is the development of resilience in children. And we talk about resilience as sort of the positive aspect of a person's being that allows them to overcome incredible stresses. So, I encourage you to do a little reading after this to think about what are those acute crises that affect families, but also look at and ask yourself the question, what is it about, the one person in 100 who undergoes an incredibly devastating event, but moves forward past that, and that trait we think is called resilience, or we call it resilience. Growing literature, a lot more to come, especially from the Academy. Just this year, this spring, the Academy put out its first statement on poverty and child health in the United States, and a technical report to accompany that, mediators and adverse effects of child poverty. So most of what we're going to talk about today is based on these two reports, and then we're going to focus in a little bit on sort of what's the status of poverty and measures of poverty in Louisiana. And this is the current AAP agenda for children, and you see some of the guiding principles around here and the foundational pieces of that, and you see that poverty and child health is one of the two high priority areas that the Academy is working on. Early brain development and child development are also intimately linked to poverty and child health. We're very well aware of things like the importance of reading to young children and how it stimulates their brain development and brain ultimate lexicon of words that they will use. So all of these facets that the Academy is focusing on are clearly intimately related. So in 1964, LBJ was president before many of you were born. And he said in his State of the Union address, the young man or woman who grows up without a decent education, in a broken home, in a hostile and squalid environment, or in ill health or in the face of racial injustice, that young man or woman is often trapped in a life of poverty. He does not have the skills demanded by a complex society. He does not know how to acquire those skills. He faces a mounting sense of despair, which drains initiative and ambition and energy. And LBJ was the president who focused our society on poverty. He started the war on poverty. And we'll look at some of the things that were implemented now 50 years ago and ask where have we come since that time. So LBJ declared an unconditional war on poverty in America. This is State of the Union address in January 1964. This is just less than 3 months after John Kennedy was assassinated. And he told the Congress that the richest nation on earth cannot afford to win it. We cannot afford to lose it. And so he immediately spelled out the difficulty of the situation. Winning the war on poverty doesn't mean just giving more money, and we clearly can't just print more money and say, okay, poverty's gone. But at the same time, as a society, we're only as good as our poorest. Look at education. it's a great area where, as a society, we're only as good as our public education is. And the better our public education is, the better we as a society can progress. So the program LBJ proposed will emphasize this cooperative approach to help out 1/5, there's the first number assigned to poverty, and of all American families with incomes too small to even make their basic needs meet. And he said our chief weapons in this pinpointed attack, so he's still using the war mantra, better schools, better health, better homes, better training, and better job opportunities to help more Americans, especially young Americans, escape from the squalor, misery, and unemployment. So he clearly said, this is the number we're after, this is the way we're going to do it, and he put into place over the next several years some major components through legislation: Economic Opportunity Act of 1964, the Social Security Amendments, which created Medicare, I think revised Medicare and Medicaid was created, the Food Stamp Act made the food stamp program permanent, Elementary and Secondary Education Act, all of which are still very relevant to our current times. However, look at the next 50 years. Here is where median household income was in 1967 estimate, about $45,000, and 2014 estimate, about $53,000. So we see that there has been a modest increase in median income, but more important and more telling is what's happened to the gap. So here's that median income again, from $44,000 in 67 out to $53,000 in 2014. You can see the 10th percentile is here. Not a whole lot of change, about 21% in the median and 21% in the 10th percentile. That means 10% of families make less than this annually. But look what's happened to the upper echelon. The 90th percentile has increased over this time period by 69%, and the 95th percentile has increased by over 75%. So what does that show us? The gap between the haves and the have-nots continues to widen, and overall, our country is not a whole lot different in its base economic status, that is the median income.
So I assume those are adjusted for inflation, right?
This is inflation-adjusted dollars, yeah. And all of those kind of finagling and calculatory jockeying all go into this. So what this means is that the 95th percentile in 1967 was the 90th percentile in 1985, and the 95th percentile in 1985 was the 90th percentile in 1998. And that's a pretty quick advance in the upper echelon of our economic status and families. So how do we compare? This is too difficult to read, but this is some information from the census, and it compares 30-year-olds in 1975 to 30-year-olds in 2015. And some of the interesting characteristics are shown here. In 1975, 90% of 30-year-olds were living on their own. In 2015, only 70% of 30-year-olds were living on their own. So more of us are living at home, and more young adults are living at home. The marriage rates are down from almost 90% in 1975 for 30-year-olds to only 57% in 2015. So more likely to live at home, less likely to be married, and much less likely to have a child, and more likely to have a high school diploma, more likely to be in the labor force, moderate income, but many fewer are homeowners by about 20%. So you can see all of these different facets moving, and some getting better and some getting worse, and we can explain why some of these happen, right? Some young adults are still living at home when they're in medical school because it's expensive to go to medical school, and there's nothing wrong with that, but unfortunately our parents can help support us, but sometimes. And so there are a lot of factors that have changed in this, but the bottom line is that if you look at these, if you consider these measures of progress, it's hard to tell where we're going. Educational attainment, we know, varies by ethnicity, and this is the percent of 25-year-olds or older with a bachelor's degree or higher, and it's broken down by native-born in the United States or foreign-born. So let's look at native-born, white, non-Hispanic, at least 35% of native-born white Hispanics in the United States have a bachelor's degree or higher. When you look at foreign-born folks who live here, you can see they are even better, about 45% or better of white non-Hispanic, foreign-born have a college degree or higher. For African Americans, you can see foreign-born still do about 10 points better than native-born, but native-born are about half the rate, or not quite half the rate of Caucasians. Asians, you see very close, and they clearly have the highest rates of bachelor's degrees out here, well over 50%. And for Hispanics, it's interesting that foreign-born Hispanics, no surprise, we can predict this, don't have as high an educational attainment as native-born, and that's probably because of the more difficult transition for Hispanics coming to this country compared to African Americans or African or black and white people. So educational attainment varies by race, no surprise. It also varies by country of origin. Now, how do we talk about poverty and what do the numbers mean? And you're going to see a lot of information come out from the federal government, and it's all related to what's called the FPL, Federal Poverty Level. And that is based on a calculated number of dollars that are expected to provide for a family depending on how many people are in the family. So it's an algorithm, how many adults, how many children, and based on what the expected minimum amount of money they could live on. And so poverty is here, and the proportion of children who live in poverty is about 21%. And that's been fairly consistent. The federal government sets this number, 24,230. That is for a family of 2 adults and 2 children living together. And this is the dollars they are expected to live on. Really? You think we could live on $24,000, a family of 4? Very, very difficult, okay? But what I'll show you is that this number doesn't include a lot of things that families have access to. It doesn't include, for instance, health insurance coverage under Medicaid. And so we have to think about what's there, but also what's not there. When it comes, this is 2014 data. When it comes to number of children living in poverty, that's about 15.5 million. So poverty is related to the federal poverty level. When you get up to 2 times the federal poverty level, or anybody who lives below twice the federal poverty level, we call that low income. And that number, dollar-wise, is double this. So 2 times this is 48,460, and about 44% of all children live in homes that are considered low income. That's over 31 million children. And when we go to extreme poverty, we're going down below. How many people live at half the federal poverty level, less than 50%? That number, $12,115 of income to the home annually for a family of 4. All right, you can see how stressful that would be. But 9.3% of children live in extreme poverty, and that's somewhere close to 6.5 to 7 million children. So the numbers of children are important for us. These numbers here are, in some ways, a little bit artificial. And we'll talk about how they're derived. But these numbers also vary by race. 46% of African American children less than 6 years old live in poverty. So this is the overall weight, 21%, but in African American, 46% live in poverty. And this shows you a breakdown of the percentage of children in low income and poor families by age. So remember, low income is less than 2 times the federal poverty level. Poor is federal poverty level or below. And this is by age. You can see that as children age, the rates of poverty in their homes go down. Does that make sense to us? A little bit, because these younger age groups may not have access to school, and their parents may have to be home with them. There are other expenses of younger children. You might have to pay for diapers and formula and other things that are more challenging. And as kids get older, generally their family income situation improves to some extent. Kids are a little cheaper to keep when they're older, right? They're not getting out of clothes as fast and don't need new shoes every 2 months. It's more like every 6 months when they get to be teenagers. All right. We can also break down the poverty stats by race and ethnicity. So the overall numbers of this is, let me get my bearings straight. This is the percentage of children. I'm missing this one. I'm skipping this one. Sorry. Okay. So here is the percent of children in high and low income and poor families by parents' employment and education. Again, not a big surprise here. What does it say? Well, start in the middle here. Low income families, 88% are not employed. Poor families, 71% not employed. So when you look at their educational status, low income families, only 30% have some college degree or more, and poor families only 12%. As you get less education, you're more likely to be in the low income or poor ranks. And based on your employment status, if you're full-time employed, you're very unlikely to be low income or poor. And as you're less employed, part-time or not employed, those rates of poverty increase. So not a whole lot of surprises there. Now, so here are the poverty thresholds for 2015. And they get updated every year, and here's the number we've been looking at: 2 adults, 2 children, $24,036. And but here's that algorithm: single individual varies by age. If you're older, you're expected to live on less. Single parent with 1 or 2 children, you can see the numbers there, and 2 adults, 0, 1, 2, or 3 children. What the federal poverty level is. Now, how is that number calculated? I think that's our next slide. That number is calculated based on several factors, and it's considered the official poverty measure. So we said number of family members. It also includes 3 times the cost of the minimum food diet in 1963. So why do we go to 1963? What was the minimum food diet like in 1963? I sure don't remember, because I wasn't born yet, but some people might. So the issue here is that the economics have really changed over the past 50 years, but the calculation of the federal poverty level really hasn't. It hasn't taken into account things like housing is much more expensive now and a much greater proportion of our expenditures than it used to be. And food costs vary by region of the country. There are a lot of differences, even by region of a city. You know, go to Brookshire's and go to Kroger and see the price differences in there. So there are a lot of things that in this calculation need some updating. So what's been happening over the past few years is the federal government has also been calculating a supplemental poverty measure, and it still includes family members, but it also includes co-residents, that might be unrelated to the children who are cared for in the home, because it's the whole household. It's not just the biologically linked mom and dad and children. It includes a more reasonable number of the 33rd percentile of expenditures on food, clothing, and shelter and utilities with exactly 2 children multiplied by 1.2. So it gives a little fudge factor. But it takes into account not just what a minimum food diet would be, but the increase in cost in shelter and other things. Geographic adjustments are included. It's a 5-year moving average of expenditures of these different items. And it also includes cash income plus in-kind benefits. And so here we're talking about things like the Supplemental Nutrition Program, SNAP program that provides for food for children in poor families. We're also talking about WIC and other things that clearly impact the ability of a family to make ends meet. If you took away WIC from all our patients, many of them, their babies would ultimately be the ones to suffer. So this new supplemental poverty measure that is been used over the past 5 years, but not the primary one published, is good to compare to the official poverty measure. And I think I've got so here's what is also included. Here's the SNAP, school lunch program is included in there. There's WIC, housing subsidies are also included in the supplemental program. But it takes away taxes, and the major one that it takes out or includes in the calculation, that is, it subtracts from your income, is the medical out-of-pocket expenses, the MOOPs. And the MOOPs, it turns out, are the single biggest reason that families end up in poverty or stay in poverty. Unfunded and out-of-pocket expenses for medical care. And it's usually from a catastrophic event of some sort in an underinsured family. All right, so how do we compare, how do those rates look? You can see what goes into each one of them. You see Social Security reduces poverty in both of those measures. So to the left of this line is things that improve the poverty rates, and to the right is things that make it worse. So here's those medical out-of-pocket expenses. Those worsen the poverty rate by at least 4 percentage points or up to 4 percentage points. Social Security benefits improve poverty. Refundable tax credits. This is our earned income credit for working parents. It actually helps reduce the number of people who are classified as being poor. Supplemental nutrition assistance program. Here's SSI. Housing subsidies. School lunch, a very minor component. WIC, surprisingly not. But again, WIC doesn't go forever and ever. It's a time-limited thing for moms and babies. Workers' compensation. Here's child support paid. Increases the amount of poverty barely. Federal income tax worsens poverty. FICA, work expenses, etc. So you can see how each of these things that we do as subsidies of society, nutritional assistance, school lunch, etc., help families and reduce the rates of poverty, whereas these other things some of them are federally dictated, but these out-of-pocket expenses are one of the number one reasons that worsen poverty for families. Hence, the logic of programs like the Affordable Care Act and the push to get more people on insurance programs, because even if we pay the subsidy for a subsidy for their insurance benefits, ultimately as a society we improve, because when their medical expenses are covered, it's less burden on them and less burden ultimately on society. So what do those poverty rates look like? If you use, and this is for children, using the official rate and the supplemental calculation. And you can see this is for children and for older adults. I can't say elderly. Older adults, more than 65. But officially for children, we can see that the rates have been around that 21% level that I told you before. There was an adjustment a few years ago by the Census Bureau, and it didn't change things a whole lot, but in 1 year it did. But we're still at that 21% by the official poverty rate. Using the supplemental poverty measure, kids look a little better, about 5% less poverty, or 5% fewer children live in poverty using this supplemental calculation. That's a good thing. It's a more fair calculation, but we have to get used to using it, and we have to understand what are the things, again, that, like the Fed is trying to do, that impact and improve outcomes in the long term. Okay, so here is the graphic over time of this is the number of children in poverty in millions. 12.3 million in 1999, and you can see poverty. The number of children living in poverty went up dramatically with the recession of 2008, 2009. It's begun to come down down to about 14.7 million kids, and that's a rate of about 19.9%. Again, using the old calculation, the official poverty measure for children. But you can see how that recession impacted families, many people, and the impact on children is fairly dramatic here. So the 2014 stats on the number of children under 18 living in poverty, about 15.5 million. We're at that 21%. It varies by ethnicity, and you can see that, again, in African American and Hispanic populations, it's about a third of children live in poverty, compared to only about 1 out of 8 kids in the white and Asian families live in poverty. Poverty is also regional. Percentage of children living in poverty are higher in the South than compared to the West, Midwest, and Northeast. Not a big surprise, not earth-shattering, something that you may have known already. So what are the consequences for children of growing up in poverty? And this is where what the Academy really wants us to focus on is when kids grow up in a stressful environment, it leads to worse outcomes over their lifetime. So we know that economic hardship leads to parental stress. Depressed marital mood, marital conflict are more common in homes where there's economic hardship, and this obviously affects children's stress mechanisms. Chronic stress of poverty during early childhood is associated with impaired suppression of the amygdala, that switch on for the stress response. And the prolonged activation of the body's stress response ultimately becomes intolerable in the absence of some buffering effect, especially a supportive adult relationship. This is where resilience comes in. If we can build resilience in our communities and in our families, then we ultimately are able to reduce this stress and its chronic effects. Activation of stress response leads to one of Dr. Gungor's favorite hormones, cortisol. And we know that cortisol levels correlate with poverty-related factors. Poor quality housing, African American race, adults leaving the home, and the duration of family poverty. You can measure salivary or urinary cortisol, and it tracks very closely with family's economic status. Amazing. And hence, it shouldn't be a real surprise that you see a lot of obesity among poor people, right? Poor kids are more likely to be obese than to be lean compared to non-poor. So more consequences of poverty. We know that there are limited housing options for people who live in poverty, urban crowding, violence, and a lack of safety in many of our poor neighborhoods. If they choose to live in a rural setting, it may be more isolated, lacking social support mechanisms to deal with poverty, things that are common in the city like food banks and food pantries and things like that are hard to find in rural areas of the country. We know increased lead exposure is not a trivial thing. Look at all of the data we have about Flint, Michigan in the past 2 years and the major problems there. Poverty also means limited access to quality educational opportunities. Poor schools or schools that are located in poor areas of town have fewer books, limited extracurricular activities. Parents don't want their kids out on the outdoor basketball court. They're afraid somebody's going to drive by with a gun, and kids will get incidentally shot in those situations. These schools also have larger class sizes and less skilled teachers overall. And so when you start out in poverty, in the stress, the crowding, the limited educational opportunities, and especially many who don't get preschool education to prepare them for school, then it's a difficult situation to come out of. Suboptimal nutrition. I told you obesity is 7 times greater than underweight in kids who grow up in a poor household. Poor academic progress because of stress, parents not reading to them, all the things we know are fundamental to brain development in children. Incarceration continues to be a major problem, especially in our African American populations, and for many of them begins a cycle of incarceration for little things because of the stress of the home, and they end up in the system for a very long time, missing out on education and educational opportunities, etc. The lack of health care, we're all very aware of the increase in infant mortality, increased adolescent pregnancy, although we have in Louisiana seen some improvements here, as have other places. We have more low birth weight and premature infants in families of poverty. Delayed growth and development, less reading we talked about, lack of school readiness, that's a real big focus in the academy now. More tobacco exposure, more electronic media. So even despite being poor, you see many people with $500 and $600 cell phones and very expensive electronic toys that they use to entertain their kids rather than interacting with them. And kids from poor families are more likely to have a diagnosis of behavioral disorders and ADHD and then ultimately substance abuse. And we have to be aware of this sort of bias toward making a medical diagnosis and a pharmacologic intervention in a family when the situation is really related back to the stress of the home. And kids act out in relation to stress in the home, especially in school, when some areas of our state, almost half of 8-year-old boys are on stimulant medications. That's pretty scary. Those are huge numbers, and there are regional variations that we're beginning to really focus in on. And so as Vice President of the chapter of the Academy of Pediatrics, I've been able to see some data this past week about who's prescribing ADHD meds. And pediatricians are doing some of it. Psychiatrists and psychologists are hard to find, but they do some also. But there are also podiatrists, dentists, dermatologists prescribing ADHD meds. I can't imagine it's in their scope of practice. There are OBs prescribing ADHD meds to 9 and 10-year-old children. Some of them are boys. Clearly not in their scope of practice. And these are the kind of things that from the policy level, from the organized medicine level, we can begin to get some data and focus in on and say, where's the problem here? And identify those problems. But those are scary situations, clearly out of scope of practice. All right, so this is like one of the graphics I showed you before. What things reduce child poverty, not just poverty overall. And we see, starting with WIC, it helps improve child poverty. Tax credits, here's the earned income credit, both state and federal earned income credits. But in Louisiana, we just got rid of the state earned income credit, or reduced it severely. So the impact there in our state is expected, you're going to see maybe a little more poverty. Social Security helps improve status. That doesn't affect our kids very much, but supplemental nutritional assistance clearly impacts child poverty, child support, these other things. School lunch, a little better, helpful for children overall compared to adults, of course. Nursery and preschool, we know the importance of Head Start and school readiness. And this is United States data overall for 3 and 4-year-olds. And you can see that, number one, about not quite half of 3 and 4-year-olds are in preschool. Does that mean they're not school ready? Not necessarily. There are a lot of programs that would not be counted here. These are in organized and more formal programs. And we also know that, that preschool varies by income. In the high-income families, over 50,000, you can see many children, almost 2 million children who are in preschool come from families making $50,000 or more. You can see that families that make less than $20,000, there's a big blip here, because this is where we've, as a society, put our dollars into Head Start and access for kids living in poverty. But this middle group of children and families who make $20,000 to $50,000 are less likely to be in preschool, which means less likely to have really effective school readiness by the time they get to grade school. So the return on investment for early childhood education is somewhere between $1.80 and $17 for every dollar spent. It's hard to really put a dollar value on early childhood education and really its return on investment. But we know that there's improved academic and occupational outcomes. Kids who start school ready because of preschool are more likely to finish high school, finish college, and even finish a professional school. Lower cost of remedial education if they're ready, and especially reduced juvenile justice involvement. If kids have opportunities to build resilience, build relationships, if the home is so stressful, the school is a surrogate in some ways, in some appropriate ways at times, to help kids grow and be ready for society. And so early childhood education is one of the major areas where we can be advocates for our children. So I'll skip those. Public education spending, this is interesting. Nationally, we spend about $600 billion on public education, and it's hard to read these, but the vast majority of that is instruction salaries and wages and employee benefits. That's about almost half, almost $300 billion. And this graphic shows kind of a heat map showing you how much is spent per child on education. And this is in public education spending. So the darker areas spend $16,000 or more per child on education. The lighter areas, the whitish ones, spend less than $8,000 per child on education. And in the middle are other things. So here's Louisiana. Look around us. Most everybody around us is spending $8,000 to $10,000 per year. We're in the $10,000 to $12,000 per year category. But yet, where do we rank educationally as a state? 49. Yeah. So we spend more, but we think we get less. We think we get less. We probably do. So in Louisiana, we spend on average $10,750 per student. So we're even, right in the middle. We're right at the national average, but yet ranked 49th in education. Amazing, huh? Here, it's hard to find historical data and ask where were we as a state back 50 years ago. But we can at least go 20 years ago or more and ask where was Louisiana, and our rank as a state was 50th in 1989. We improved to 47th by 1979, but then we dipped back down. Oh, sorry, this is going backwards. 69, we were 49%, then 47, back to 50th by 1989. And so we still rank as one of the poorest states by far, no doubt. That varies by region within our state, not just within our nation. And so if you look at, I think I highlighted a couple of these things. Nope. So here's Shreveport, child poverty rate in 2013, right just below 30%. Monroe, even higher, more than a third, 36%, has the highest child poverty rate. The lowest is down, I think, here in Houma, 17.3% child poverty rate in 2013. So it's some significant variation by region. Basically, that means Monroe's child poverty rate is twice that of Houma. That's a substantial difference. So how are we doing? Well, our child poverty in Louisiana remains above 2008 levels. 28% of our children are below the poverty line compared to about 25% in 2008. And it's basically remained unchanged over the past 3 years. We're waiting for the 2015 data on our state. In 2010 to 2014, 21% of our children lived in high poverty neighborhoods. So these are neighborhoods where there is more poverty around them. And this is a 24% increase in the percentage of children in the prior 4 years. So more kids are living in higher poverty neighborhoods. That could just be that neighborhoods are deteriorating, right, such that they become high poverty neighborhoods. Louisiana is just one of 5 states in which the percentage of children in households that spend more than 30% of their income on housing was higher in 2014 than 2008. So increasing expenditure on housing, and almost a third of children, 32%, live in housing burdened families. That is, under houses that are in distress or poor living conditions in the household. And 2012, 2014, 49% of Louisiana children aged 3 to 4 were not attending school, but that means that's actually better than the national average of 53%. So we were ranked 7th on this measure of kids going to preschool. And we were alongside states with significantly more resources, if you go look at that map, Colorado, Hawaii, and Vermont. So we're doing pretty good at getting kids into preschool. We could do a little better. We're doing better than the national average and ranked 7th as a state in getting kids into preschool. That's good. We'll take a positive, right? And here is the percent of children in low-income families. Remember, this is twice the federal poverty level, is what low income means. And we see the disparity across race and ethnicity. Only a third of white children live in low-income families, whereas almost 3/4 of African American kids are in low-income families. Hispanic and Asian populations are much smaller, but their numbers are significant as well. So we end up with some interesting dilemmas. This is from Louisiana Budget Project, and just in August, through all the debate and all the issues in our state legislature, and they say one of the most visible and damaging consequences of our budget quagmires is the effect they've had on low-income parents seeking quality, affordable care for young children. The number of children served through the state's child care assistance program dropped from nearly 40,000 6 years ago to around 12,000 today. So the programs that can help our children that have been responsible for that number 7 ranking in getting kids into preschool have been cut. And I talked about the earned income credit. A ranking of the best and worst states to have a baby, Louisiana is second to last, based on 17 different metrics. And the ranking compiled factors like delivery costs, mortality, all these things on a 100-point scale. Louisiana scores 29.25, while Vermont, the highest rank, was more than double that. And what we found in Louisiana, we have the 5th highest infant mortality rate. We have the fewest midwives and OBs per capita, and the 3rd fewest pediatricians per capita. We know most of our state is considered low in terms of numbers of physicians per capita. And OBs and pediatricians, I think, have the largest amount to contribute to some of these statistics about infant mortality and child well-being, ultimately. But finally, there is a little bit of good news. This just came out last week. Median household income from 2015 rose up 5.2% from 2014, according to the Census Bureau. The first increase in median income since 2007, the year before the Great Recession started. So there is at least a small, maybe some people say, increase in budget for the middle class. The poverty rate ticked down, as you would expect, as income goes up, to 13.5%, down from 14.8% a year earlier. And because of the Affordable Care Act, largely, the share of those without health insurance dropped below 10%, and that's a staggering number in the whole population. The adult and kids, we know that number stays very low. 2, 3, 4% of kids don't have any health insurance. It's uncommon for us to have kids without health insurance. So how far have we come in 50 years since LBJ declared the war on poverty? Reducing the proportion of children in poverty? Not so much. Improving education? Yes, in many areas, but we still have a long ways to go. Improving incomes? Modestly, but that gap between the haves and have-nots, the separation in living between the haves and have-nots, the tax base has shifted, and that changes the funding for education and health care to favor people of means. Improving health? Absolutely. We've improved health. Kids are healthier than they've ever been in human history. You hear me say that at least once a day. That's because of things like vaccines and antibiotics. Hospitalization rates for kids are probably lower than they've ever been. And many people, including people who run hospitals, are getting the picture you can't make a lot of money taking care of kids because they're not very expensive to keep on the healthcare side now. Improving homes, modestly, but still a long ways to go. And improving job opportunities, very difficult to say. Our economic base has shifted dramatically from manufacturing after World War II now to high tech, and there's still that gap between what we have available as a society to drive high tech economy is large. It's a large gap. So what are we to do as pediatricians? And the basic 2 questions you can ask of families are you having trouble making ends meet each month? And how are things at home these days? And these are very simple questions. And one of the things that I think you could do is, just like we dismiss the parents when we talk to teenagers, it may be important to have 2-3 minutes with the parent without their kids around. Because as parents, we want our children to feel safe, protected, secure, and all those things. And so in front of our children, we're much less likely to say, we're really stressed, or we're having a hard time making ends meet, or mom started drinking last month and hadn't stopped, or whatever it may be, or grandma moved in and it's really a hard burden on us. So having potentially a 2 to 3 minute talk with the parents privately may give you the opportunity to ask these questions and really get an honest answer, like we think we're going to get from our teenagers when we dismiss the parents, right? But start with screening. As general pediatricians in the community, many people have long-term relationships with families, and we know their parents, their grandparents. We've taken care of multiple generations, and we have a relationship with them where we might know about these things. We might see, now on Facebook that they had a house fire or something else. There are a lot of things we learn, but these simple questions will be helpful. So we can also be aware of how to screen children for signs of economic stress. So think about the flooding situation down in South Louisiana in August. And I know a pediatrician down there who had 18 inches of water in his home. No flood insurance. Home damage, $300,000 in damage. And this is a man who's solid middle class, has a good income. He can go to work and does well. But a $300,000 hit to his economic status is not trivial. And so the acute stresses like that can manifest in different ways in children. So here are a few of them. If the family has loss of insurance, you may see a child change from private school to public school. Where they've been in private school for 6 years and all of a sudden they're in the public school. There may be a lot of reasons for that. But loss of insurance or a loss of a job by a parent may be a provocateur of this kind of change. Behavioral issues, especially acting out, are a very common manifestation of stress at home, especially acute stress. Mom or dad may have to travel more for work, putting more stress on the family. You may just hear that. Oh yeah, dad's been traveling a lot more. The kid may tell you that. And then you think, just a follow-up question, tell me more. Why is that? Why is he traveling more now than he used to be? Not playing a favorite sport this time of year. Costs about $150 to $200 to sign up for baseball now. Costs about the same if you're in Cabosa soccer. Most of the schools may not have those things available. So, a kid who's been playing baseball for 3, 4, 5 years in a row, getting good at it, but all of a sudden this year he's not playing baseball, it may be financial. And that $200 may make a big difference. Weight gain and poor sleep as manifestations of behavioral issues are also things you may note as indicators of economic stress at home. Teenagers taking a summer job, well, that's great. That's a real positive thing. But you might ask the teenager, do you get to keep the money? Because for some of them, going out and getting a job, the money goes to mom or dad to help support the family. That's not inappropriate. That's an okay thing, but it's an indicator for us of the economic stress in the home. And we've had Cassie Hammett here talk about young women being leased out and sold out for sex for money to help support families in some situations. So it can be extreme, not really a summer job. Recent or frequent moves to a new home or sharing of a home. We just moved in with grandma because whatever reason it was. So these kind of things, again, these may be soft signs of economic stress, and they're clearly nonspecific, but they're things that you may be aware of when you're talking with the child. A 6-year-old's going to tell you everything, right? They're going to say, oh yeah, we moved, we're in a new house, we got an apartment, we sold our house, we got an apartment and all those things. Daddy doesn't have to cut the grass anymore. Interesting. The economics are oftentimes part of it. So what should we do? Identify family strengths and champion them. When we identify these issues, especially back to the first two questions, ask of the family, what are their positive coping mechanisms? How are they dealing with that? And where are their extended family and community supports? We may need to help them find some supports. Think of a middle-class family whose house is flooded and all of a sudden they're living in a shelter. They don't know what to do. There were small business owners and have lost their small business. They're really stressed, and dads and moms are sitting there just thinking, I don't know what to do. I don't know what to do. I don't know how we're going to recover from this. Connecting them with community supports and helping them realize what's available in the community. Food banks, rental assistance, school contacts can be very helpful. Obviously, Medicaid expansion is important, and legal assistance programs are available in most parts of the state. And it's not hard for us to have some of these references where we are, where we're practicing with our patients. And when we identify issues, try to help get them to the resources they need. But here, these positive coping mechanisms, that's the resilience. That's what we can, even if all we do is help identify one or two positive things the family's doing or the child is doing to cope with it, and tell them to keep up the good work and don't give up. If it gets worse or you have trouble, call me. Just that knowing that somebody cares and listens to their status. Garrison Keeler says, nothing you do for children is ever wasted. They seem not to notice us, hovering, averting our eyes, and they seldom offer thanks, but what we do for them is absolutely never wasted. So the last category is what I call potential catastrophic life events of families, PCLEFs. These are situations that families often don't survive as a family. Divorce is a common outcome. And so in some of these situations, death of a child or a sibling is extremely stressful on families. And a lot of marriages don't survive the death of a child. It may not be till years later when they haven't even fully grieved for the loss of their child or haven't really worked through it. Unexpected death of a parent or spouse. So for anyone who's lost a parent unexpectedly, even as an adult, that is a very stressful thing in the life of a family. Job loss, especially if it's for cause, for something, underperformance or a drug or alcohol problem or other things that set up a long-term pattern. These natural disasters like the flood, some acute financial event, the recession was a clear one in 2008, and severe physical trauma or near trauma, and I would add to that, also psychological trauma that can come from mental illness in a parent or a grandparent who's living with them. There are a lot of things. So these are the ones I consider potentially catastrophic because they may just be the thing that tips the family over the sort of the cliff of intolerability, unrecoverable from one of these situations. These things can provoke mental health breaks and other things. And so it's important to note these kind of things in your screening, in your interaction with children and families, because you may see the outcome of these. So in conclusion, the epidemic of poverty continues, but there are a few hopeful signs, we absolutely have to stay engaged in the war on poverty, really for the sake of our children and our society. When you pay taxes each year, I tell people every time I see them, they thank me for what I do. I say, where are your tax dollars at work? So when you pay your tax bill, think of me. That's important. That's important for people to know where their tax money goes, and part of it is to places like this. Within our practices, simple screening can identify families who are struggling and provide an opportunity for support. So I think that is it. Any questions? You have your charge. Ask those two simple questions. You'll be amazed what you find. And the follow-up question can be just as simple as, tell me more. And they will. All right, thanks.